Hello, everyone. Welcome to the Glow Podcast. I'm here today with a very exciting guest. I have Dr. Mike from Tangelo Health, who is a sports chiropractor, and I'm really excited to speak with him. But if you are new here, we are Tailored Marketing, and we help health, wellness, and longevity brands grow their businesses through strategic marketing and sales strategies. So if you are interested, drop a comment below. Dr. Mike, thank you so much for coming on. I'm super excited to speak with you. If you would, I would love if you would just go ahead and give a little bit of an introduction so the listeners know who you are.
Taylor, thanks for having me. I am Dr. Mike Smith. I work in Seattle, Washington at Tangelo Health. We have two clinics in the Seattle area. We're in West Seattle, that's where I practice, and in Green Lake, just north of Seattle. We've been open for about 13 years now. We have a team of 4 chiropractors, 2 rehab specialists at each of our clinics, so we're happy about that. And it's just a fun place to practice in Seattle. We have awesome patients. It's a very active, educated population that likes to move and likes to feel good. So we like where we're at.
Yeah, no, that's super awesome. And what would you say, because Seattle obviously is a big city. I'm actually here right now myself, so I know, and it's great. But what would you say kind of sets you apart from other chiropractic clinics in the area, and like why your patients keep coming back to you?
Sure thing. You're picking a really good time to be in Washington and the
Yeah.
Pacific Northwest, but you're leaving at the right time too. So well done for you. So we are chiropractors by trade. I like saying we're sports chiropractors. So as a sports chiropractor, we're going to integrate lots of different modalities. We're going to have a little bit different approach. Sometimes when you say a chiropractic, that can put you in a box.
Yeah.
That's a good box, and that serves a lot of healthy people. But at Tangelo, we're going to focus on everything, right?
Yeah.
How you move, your programming, your training, what your goals are, which people do that. But then how do we do that in a context with movement? How do we work on soft tissue structures? How do we use chiropractic manipulation to get joints moving? But that's a very small piece of the puzzle, if I'm being honest.
Yeah.
When you integrate movement, you integrate the soft tissue work, you integrate lots of different modalities. People are feeling better, and you get out of pain quick. But then you pair that actively and heavily with the exercise component. So rehab's really important. That's what we're really good at, is combining the two.
Yeah.
And that's not new, right? The manual therapy, the passive care with the active care, that gets people better quicker, gets people feeling better longer. But then ultimately, what's the whole patient experience from the time they see our website all the way through a positive outcome, hopefully in the clinic? What's that look like?
Yeah.
So I hope you're getting the vibe here where it doesn't feel like a doctor's office. We have big, active rehab floor. We have open bays. We have music playing. So a lot of times when people are suffering from injuries or chronic pain, it takes a lot of work. So to be able to create an experience where they actually enjoy coming here, we can be a very positive part of their day. That really matters to us. And I would say that's more of our edge and focus on that client and patient experience to honestly create a higher value. And it's cool when you do that because it usually leads to better outcomes. So that's what I like to think, how we separate ourselves.
That's super cool. Yeah. And I feel like people sometimes have the wrong, a misconception with chiropractors that you just go and they crack your back, you know?
Yeah. And to be honest, that's great. We're helping a lot of people that way. Those are
Yeah.
great alternative treatments. And everything has its place. There's
For
so many
sure.
people out there that have their preference for care, and that's awesome. We just do a little bit different at Tangelo.
Yeah, no, and I think that's awesome. And like you said too, it's you want to create a positive environment where people want to keep coming back. And I feel especially if you are dealing with an injury or chronic pain or something, going somewhere where you're dealing with that, where it feels comfortable and fun, and the staff is inviting and practitioners are educational, and
Right.
you just have all of these different components to wanting to go back somewhere, because there are so many options for different kinds of care. So it's creating that environment as well where people are like I'm excited to go to Tangelo today.
Right. No, and you hit all, and that's small business 101.
Yeah.
Sometimes it's we're in the customer service industry. We just happen to be providing healthcare,
Mm-hmm.
right? It's that competitive, and it matters that much for that patient experience. If there's so much information out there, you can go chat GPT and probably get a pretty good low back rehab program.
For
But
sure.
where's the certainty? Where's the trust? Am I doing the right thing? So there's that component. But also it's like, yeah, it's like gone are the days where like I'm already a little depressed and bummed out that I'm hurt. And now I
Yeah.
got to go take an hour out of my already busy schedule. I got to go someplace with like red carpet and elevator music. Like,
Yeah.
I don't know, man. And so the cool part, Taylor, is like you look at like chronic pain research and positive patient outcomes and guidelines around there. It's not the best technique or the best, like there's like 5 certain exercises that's like that has its place, but it's is there optimism? Is
Yeah.
there good energy? Or do I have a good outlook? Do I understand and have clarity about what's going on?
Yeah.
Do I have a support system around me? And some people don't. Like we take that for granted. So they can
For
come into
sure.
a clinic, have somebody they trust with a team around them. Cool, I'll come here for my injury. And then you kind of hit on the head. Like people are active, man. People are looking for ways to like longevity is hot right now.
Yeah.
Good. Right? What do I need to be working on now so I can live long later? And I don't want to be in a wheelchair. I want to live long and healthy lives. You know, like we see people that work through our program, and it's cool to like when there's an environment that like, hey, they keep coming back. Like we say, we're their life's locker room, where like
Yeah.
they come in for depending on season as they're training for something, depending on what's going on in their life. So yeah, that's a huge compliment for team and how we approach things when we get that kind of long-term patient.
Yeah, no, for sure. Well, and I feel like a chiropractor too, like, can is one of the people, like, if you go to a chiropractor or even like other holistic kind of doctors, those kind of almost become like your primary care because you're seeing them more often than you're seeing your physician, and maybe you're just going to your physician to get like your blood test done and like that type of stuff once a year, but you're going to your chiropractor more than once a year for most people, especially like if you are going through chronic pain or you're having an injury or something like that too.
Yeah, we have the opportunity to hit it. Like we get more touch points, and then we're building that kind of relational equity, that rapport, and that trust. And it's tough to do that in today's system, right? And
Yeah.
sometimes nobody's fault, right? But like when you got to I have chronic low back pain, and I saw the orthopedic specialist or the neurologist for 10 minutes. Like you're not going to get the whole picture.
Yeah.
And then that's once every quarter or 6 weeks. There's a lot of stuff happening. So yeah, I'm sure that resonates with a lot of like we'll say conservative management, like any type of therapist like that, where yeah, I mean we have our niche and we have our profession, but also you become a little bit of a therapist in general,
Yeah.
right? Because and again, like that's part of the puzzle, right? That's
Yeah.
and then the science supports that. We even saw something that like people who are stressed out and tired, like actually there are a lot of cool stuff coming out with like women's studies where if the chemistry's off, the hormones are off, the stress is really high, like tissue thresholds drop, pain thresholds drop. So I mean, how many times like I didn't do anything and my back's on fire? Like we see it all the time, but that's not necessarily like you're weak or you got bad posture or now you need an MRI. It's like, hey, what's the whole context of the situation? So yeah,
Yeah.
we have our luxury is we get that time to really dive in and see what's going on under the surface.
Yeah, no, that's such a cool point too that you brought up, that like if you're going through stress or like maybe you're not sleeping as well, your pain threshold goes down. So it's like maybe that pain's not even that bad, but it's like
Right.
this other thing in your life is causing this. And I didn't realize that. So that's pretty cool.
And then like it's just knowing that. Like it's like, okay,
Yeah.
an acknowledgement, maybe there's nothing wrong with me, right? Maybe this is
Yeah.
actually the healthiest thing my body's doing. And then so then like on my end, it's not because like you're misaligned or your glutes aren't firing or you got
Yeah.
weak traps or something like that. It's like, hey, what's going on? And then like that dictates a little healthier intervention that leads to better results. And then ultimately there's the outcomes and the client experience you're looking for.
Yeah, no, that's super, super cool. And do you all have like patients that see you for kind of the same issues like over and over again? I know back pain is obviously super, super common. I mean, that's primarily what people are coming to you for. But is it like anything else where they're like, oh, like my glutes are really sore and I think it's like from something in my back? Or do you have like common, I guess, denominators like that?
Yeah, for sure. We like, yeah, I think it's pretty natural that like, hey, back pain, you go see a chiropractor.
Yeah.
You see a lot of like headaches, a lot of disc injuries we specialize with. There's a lot of different ways to approach that type of care. And
Yeah.
that's the stuff where like that's our bread and butter, I'd say, where like there's so much out there, it's confusing. Like a lot of people come see us because they know we kind of specialize in that.
Yeah.
But it's interesting, like at least in Seattle, like every it's a very active city,
Yeah.
and where I would say probably about 50% of our patients are like back or spine related, and then everything else, if you're moving, you're an athlete. So if
Yeah.
and then athletes are connected to bones and joints, and you put stress into those systems, like, stuff pops up. So we see a lot of general shoulder, feet because basically it's like the soft tissue work with the active care. It just starts making sense to people. And when you make sense, then like they don't really care if you're a chiropractor or a physical therapist. If you're the guy rubbing crystals, I don't know about that, but that guy's
Yeah.
practice is full. So I mean that everything has its place, but when you start making sense to people and identifying what's going on and what's going on in their lives, I like saying pain can be complicated, but solutions should be relatively simple. And
Yeah.
if you're got a body and you got some goals, like this is a good spot to check out.
Yeah, pain can be complicated. I think that it's so interesting. Like, one of the things that I have found interesting and funny is on social media, like seeing the menstrual cramp like monitor thing where they put it
Mm,
on men, and it's like just very subjective. Like, it shows you
sure.
how subjective pain is. Like, the worst level of pain you've ever gone through is the worst level of pain. Like, you have chronic pain, you're so used to pain that like it's not as much to you anymore.
Right.
And I just think it's so interesting how that works, and especially like with something like back pain too can be very mental too, because
Yeah.
like it is scary when you're going through back pain, especially because you're like it's so related to like your nerves, it's connected to your brain, like all of these different things like run through your mind kind of when you are experiencing especially back pain, I think.
Absolutely. And then, I mean, the first thing we do is we go Google it, and it's the worst case scenario,
Yeah.
right? And then you get, I mean, I'll speak for example. I just kind of rolled my ankle last week, and it's not just like I can deal with the pain, but then like now I feel old.
Yeah.
I'm not exercising this week. All right. I'm in a little bit bad mood. So now I'm sure I'm not the clinic director, dad, husband I want to be. So now that's wearing on me. And guess everybody's got an opinion, right? Everybody's had their story that worked for them, right?
Yeah.
Even I had like my mom was like, "Hey, should you go talk to somebody?" I was like, "Mom, like I'm the guy. Like I'm the guy you
Yeah.
talk to about this." It's the different layers. Like the easy part is the injury. The
Hmm.
tough part where you hit our head, it's like if there was just one exercise and one technique to do, but everybody's different, everybody's context matters. But so much of that is that you'll hear us like our world is biopsychosocial. And you got to be able to address all those things for short term, like optimism, and you're on a different pathway, and then just long term success. Yeah, we see that all the time. And usually, like on my end, it's like we're a little bit too critical. Therapists have a little bit of fixing complex where we like this is wrong, that's wrong. Where it's actually like,
Yeah.
hey, this makes sense. We're gonna figure it out together. Let's calm it down and give you some strategies to keep moving. You're gonna be all right. Like, oh, and then
Yeah.
now just that they're on a different pathway.
Yeah, it's almost like that mental piece is kind of like the hardest. It's like, okay, the physical portion of it, you're gonna be able to get through. Like, no one's dying over a rolled
Most of the
ankle,
time, yeah, most of the time. At least, yeah, like that's my luxury too. So that's the patients that I see. If it's real bad, we send them to urgent care, and they got to
Yeah.
deal with that, right?
Yeah.
So context matters, but yeah, for 98% of the time, if you don't have certain, even like pain, especially spine pain, I have it all the time, like 10 out of 10 pain, they're barely walking in here. And I'm able to say, like, hey, actually, what I'm seeing here, I know you're absolutely miserable, but if we do the right things, you should be relatively like normal in a couple weeks or so. And there's no way that like we're ruling out red flags, we're getting
Yeah.
people moving, we're calming things down, like empowering them, understanding, and all of a sudden, like 2 days later, they're walking again. It's fascinating. Like tissues don't heal that fast. Like that was all sympathetic response stimulus. So the body is super smart. Sometimes the body overreacts, and it's
Yeah.
up to us to create an environment where like at least it's clear and it makes sense.
Yeah, no, for sure. I would love to hear too, like any really cool success stories, like with any of your patients that are like more specific. Maybe like, I mean, it's always fun to hear about somebody who's like, in so much pain that they're not able to do
Yeah,
something that they like love anymore. And then like they're able to start doing it again after, doing whatever kind of.
that's it. Yeah, no, you hit on it. That's like there's you always get a handful of like this is why we do it.
Yeah.
Things that are top of mind, like more recent, we added a few different type of modalities. We started working with like more complex cases. We've added like laser therapy, and that's integrated with our spinal decompression protocols. So as you see a lot of patients who have done everything
Yeah.
and nothing's working. And unfortunately, that's not it's rare, but there's a lot of people. That's a big percentage. And then typically it's like they're younger or like they've been at it for a long time. And then that's the stuff where it's like health is wealth and they don't feel very wealthy. Like it is
Yeah.
painful, like we talked about earlier. So we get them and then basically they're just like, I don't need it, but whenever I'm done living the way I'm living, like the surgeon said I'm here to operate. And even like at that point, the surgeon's like, I can't promise and guarantee stuff. Like those are tough cases.
For
And then
sure.
rightfully so, that patient's like, something's wrong with me. Is this how it's always going to be? Like you can see it affect them deeply than just like my back hurts.
Yeah.
So we've been able to take them through like more alternative treatments that are becoming more and more mainstream and just get awesome results. And then all of a sudden you change that with like laser or decompression. Now the stuff that wasn't working before is working now. That's when they're a different human being where the only option previously was surgery. And now so it's cool to be able to have like more complex cases and have more options for people. I tell people like our practice is going to look different 5 to 10 years now just because we have better technology. But
Yeah,
the,
that's
thing-
so true.
the best patient that like top to bottom and we that hits on everything is we've had two this year where moms like they came in chronic low back pain, former athletes, doing all the right things, just dealing with it. Like former athletes, it's like the bug is a feature and then the feature becomes a bug, right? They just keep pushing through it, they
Yeah.
can't get the right answers. And then it's just like, hey, let's figure it out. Let's get you moving in the right direction. And then as you build that trust and rapport, like it comes out, it's like what I always ask, like, why me? Why now? Or like, why are we actually here? Like you've done everything. Like what comes out over time is like, well, actually, I'm coming here because I need some type of option to like I want to be able to carry a baby for 9 months.
Yeah.
Right. And they're thinking about it right. But if I can't go to work and not have pain, why do I think I can? So we've had a handful of patients work through the program, get to a place where they're strong and healthy. And two moms just recently had their baby after a long journey. So we're like, when they're here, that we're high fiving, they bring the
Yeah.
baby in. To be able to create an environment like that, that's super special. So things like that, the chronic stuff, like we're lucky, like short-term acute injuries most of the time heals, but the chronic stuff and how it wears on people, if we're able to create an environment that like yeah, it's life changing. So we
Yeah.
take that seriously because people are dealing with some deep stuff. And yeah, if we can be a shining light in their day, we're going to try to do that.
Yeah, no, that's super cool. It's not just changing lives, but creating lives too.
Yeah, man. We got the easy job there, right? I mean, that's it. They got to do it.
Yeah.
That's a lot of work that they did. And
Oh,
then
for
they
sure.
they come in and they do it, and then it's peace of mind. And even like a lot of it's like as they're working through it, like I know they're good, but then like that deep, pattern of like I don't know, my back's always hurt. Do I have it? Like how do we work through that? How do we make sense of that? And then they can have really healthy, active pregnancies and then really awesome recoveries and then yeah they get to be moms, so that's fun.
That's super awesome. And you talked a little bit too about how the clinic in 5 years will look different with technology. Obviously, technology is changing a lot. And so, like, where do you see, I guess, right now or have any predictions, even if it's just for like the next year? Because I know in 5 years it's hard to predict what level of kind of technology we will have then.
Sure. I like saying the like cool, well, two things to discuss. Like I think AI tops like comes top of mind. I like
For sure.
what Simon Sinek about it. He's like, that's all great, but like humans like human stuff.
Yeah,
We have the power of like, hey, like you can't create an environment, you can't create a feel, a brand, you can't recreate human touch and how meaningful that is.
for sure.
Um, and I think like people are going to be like, as you know, state of the art technology gets better and it's better for living. I don't know if that's making us better humans, right?
Yeah,
So that's how do we that space, like I'm still confident in that space, and that matters to people.
for
Uh,
sure.
on the other side of that coin, like there's so much cool research coming out, longevity, regenerative medicine, that just like better conversations are happening. A lot of it's driven from from medicine, which is
Yeah,
like medical, which is great because they see the research, right?
for
They're like,
sure.
hey, these outcomes, like we're really smart, world class, doing world class techniques, getting like sometimes very mediocre outcomes. What are other things we can do? So a lot more stuff fueling more data to make more informed decisions and to have more data with better outcomes with patients. You're going to see a lot, in my opinion, in regenerative medicine. Like they're figuring out stem cells, they're figuring out PRP. That's my musculoskeletal world. You're going to see more interaction, I believe, and more encouragement of like, hey, let's get you out of pain in a healthy way without without drugs and surgery. It's more leveraging just general strength. And that's happening now.
For
And then
sure.
just the impact and the ripple effects both of longevity, bone building, muscle health, and what that does for like overall body mind connection long term. But yeah, longevity is hot this day. That's the number one question I'm getting. Primary, it's in all our algorithms. Like I know I'm supposed to
Yeah,
lift weights. I know I'm supposed to lift weights. I know I'm supposed to build bones, but what do I do now? And it hurts.
yeah.
Cool. So here's how we bridge the gap there. But cool technology, cool procedures. But yeah, I don't think AI is going to put us out of job quite yet.
No, I definitely don't think so. I think too with AI like replacing like a lot of back end stuff, I think that people are gonna crave human connection even more. You
Right.
know,
Yeah.
like there I don't think especially like for where you're going to have a sense of community and like not just for that, but like if that's what it's giving you with AI becoming more and more present in our lives, like you're not gonna get rid of the stuff where you have
Right.
human interaction and it's helping you. Yeah, I don't see that happening by any means either. Yeah, well, cool. Well, okay, so I would love for you to tell everyone where is the best place to find you, where's the best place to find Tangelo. I'll also put all of the links in the show notes too for easy
Cool.
access.
Cool. So if they just want a kind of a fun, goofy follow on Instagram, it's Tangelo Health. I'm in Tangelo Health, West Seattle, and
Okay.
my tag, which I'll have like more educational, clinical stuff on my Instagram at Hey Dr. Mike. And if you're in the Seattle area, if you're dealing with headaches, back pain, like we see a lot of plantar fasciitis, disc-related injuries, TangeloHealth.com is the best way to find us. And then our team's awesome. You can reach out. We can answer any questions.
Cool. Awesome. That is great. Well, thank you so much for coming on. I really appreciate the conversation and your time. Thank you.
Thanks, Taylor. I had a great time.